Hi guys, it's Amy, Dreadlock Mama, coming to you with an update today. Today's update is even more exciting than the last update that I put on because I just got a call today saying that all of my pre-op testing came back really good and they scheduled my surgery. And so the other really awesome part is that they had a lot of cancellation, so I get to have surgery in less than 2 weeks from today. So today is March the 2nd, I think. I'm not sure when I'll get all this edited and put on YouTube, but anyways, I believe today is March 2nd. I have surgery on March the 12th, Monday, March the 12th. So I'm really scared, really excited all at the same time. That's coming up really quick. So I wanted to share that with you and let you know that we'll be having a lot of good content coming up. So because I'll be making weekly updates. Also, I wanted to use this opportunity to share with you guys what happened at my pre-op testing appointment. So last time I talked to you guys, I was going to go in for that. So I'm going to give you a rundown on that. Before I do that, I'll just give you my stats really quick. I am 41 years old. I am 5'2". When I went into the surgery center for my very first appointment, that would have been last year, back around July of 2017, I weighed in at 298.7 pounds. When I went in for my pre-op testing the other day, I told you I figured I was probably still right around 280, and that's right where I'm at. So I've lost almost 20 pounds, not quite, doing my supervised weight loss program. I haven't been super intense about it since those 6 months were up, and so I need to get back on track with that because I don't want to wait till after surgery to really be disciplined. So I've been eating healthy. I just haven't been probably watching my portion control as much as I could have been to keep my calorie count down low enough to continue to drop weight. So I've maintained, but I've not been dropping any more weight. So again, I have surgery coming up on the 12th. Yay! Okay, so really quick, I went in for my pre-op testing and it was crazy. It was a lot, so I want you to be prepared. I don't know what your surgeon will put you through, but I had to show up early for the appointment. I fasted after midnight, nothing to eat or drink. I went in and right away they did an EKG on me. So I had an EKG done. I went from there to have blood work done. They did a lot, probably 7 or 8 vials of blood. I did the H. pylori test that I was telling you guys about, where I could do the breath test. You just blow into a bag. Then they actually have you drink a little concoction. You wait about 10 minutes and you blow into another bag. That can be kind of hard if you're queasy in the mornings, especially after you fasted through the night. I woke up not feeling the greatest in my stomach anyways. So it wasn't like it was super nasty. What they gave me to drink tasted like a really tart lemonade. The best thing that you can do is just hold your breath, hold your nose, and just chug it down, just like a shot, just get it down. So I did that, then I gave him a urine sample. I went on from there and had a chest x-ray. I had a pulmonary function test. So anybody that's not had a pulmonary function test, you take a big deep breath and then you blow out as hard and as fast as you can, and they measure your lung function that way. You do that a few times. They gave me what's called a spirometer to take home. Anybody who's had surgery recently, you know what that looks like because they require you to use that in the hospital a lot of times before they'll send you home. They don't want you getting pneumonia. So especially if you've had some kind of abdominal surgery, it makes it harder for you to breathe very deeply, and so you're usually not breathing in very deeply or coughing at all because you're afraid to cause yourself pain. And so the spirometer keeps you breathing deeply, pushing out hard, and that helps your lungs keep the fluid, excess fluid out, and so you don't get pneumonia. So they sent the spirometer home with me to practice on, and I'm sure that you'll definitely have one of those. It's pretty common practice, especially it's just like the shots that they give you to help keep you from getting blood clots. It's just kind of common practice after surgery. So anyways, I got familiar with that. After the pulmonary function test, I went on to do, I thought they were going to do a scope. They didn't do a scope, which is actually really great, but I did have to drink that nasty barium stuff. So they did an upper GI look at me. I can't remember what the actual test is called, but anyways, they take a look at your upper GI tract. So I had to drink that thick nasty barium. Before I did that, I had to put these crystals, they call them crystals, in my mouth. They were almost like pop rocks, just ground up really fine, and then you chase that down with a liquid. It immediately expands your stomach, and it makes you feel like you have to burp right away. It's really uncomfortable, but you can't burp. You have to hold that in so that your stomach can be expanded. So when you drink the barium, they can take a look at your GI tract, your stomach, and make sure everything's kosher in there. So they'll make you kind of roll around and get that barium all coated in your stomach. After they kind of took a few pictures, they laid me down and they had me drink another liquid through a straw while they were looking with their machine, so that, I guess, so that they could see my swallow function and everything like that. So be prepared for that. I went on, I feel like I'm forgetting something, as if that's not enough already. But anyways, I went on from there, and they did just kind of an overall physical, really talked to me about my health history, allergies, things like that. Took my blood pressure, took my weight again. So they were, let me just put it this way, they were very thorough. Just be prepared that it's going to be a long day of testing, that you're going to be poked on and prodded on a lot. You're going to have to, you know, not be afraid to drink some of these liquids and take some of these tests, okay? I think that's all that I need to tell you about the pre-op. Just know that I will be coming to you very soon, showing you, maybe talking about my surgery prep. As far as I know, really all that my surgeon asked me to do is to fast after midnight, but I'll kind of talk to you about things leading up to surgery, and then after surgery, how I'm feeling, how things are going, and then I'll start my weekly updates from there. So I am so happy to be able to share this news with you, take you on this journey with me. If you have not already subscribed to my channel, make sure that you do that. I'm getting a lot of views that people aren't subscribing, and I want to make sure that you get notifications when these weekly videos start. So I'm going to be doing the other dreadlock video that I talked about, and talk to you about how I wash my dreadlocks. I actually washed them this morning. They're still just a little bit damp, but we'll talk about that and dreadlock maintenance. But I'll make sure again that I mark those videos very plainly so that you know. I do want to make one quick distinction. I had talked about a cleanse in my last video. I am not popular enough on YouTube to be sponsored by anybody. So I'm not sponsored by that cleanse. I don't sell that cleanse. It's just something that my husband and I bought and tried. And whenever I have products like that I use, that I like, natural products or whatever it might be, I'm going to share those things with you. Never think that I would try to trick you into buying something. So if it's something that I'm related with at all, I'll let you know. I'll be upfront and honest with you on that, but I'm not cool enough to be sponsored by anybody yet. So all right guys, you have a great day, and I will see you really soon with some really good information. Bye.